first of 5 sessions. And we will provide you with tools and resources to help you promote your community collaborative in 6 steps. So session 1, which is today, will provide an introduction and overview of the Community Health Improvement Collaborative. And we will present the first step, which involves analyzing your current state and identifying a target population. So just some housekeeping items. The webinar is set up as an interactive webinar. So first we ask that you please mute yourself during the presentation and just make sure that you don't have a music background in case you need to step away. So, and we will have opportunities for all of you to ask questions later, and we encourage you to post questions in chat. However, you feel free to raise your hand. Our team will be monitoring the chat, and we will be addressing questions throughout the presentation. So we will also be sharing links in the chat during the presentation. So please feel free to add your comments or questions to the chat, or raise your hand and unmute yourself to ask during the presentation. At this time, I would like you to please just enter your name, your organization, and the role that you have in your organization in the chat area. A little bit about Superior Health Quality Alliance. We are a regional quality innovation network quality improvement organization operating under the direction of the CMS, or Centers for Medicare and Medicaid Services. We provide free support for healthcare organizations across Minnesota, Wisconsin, and Michigan. During this session, you will learn how the Community Health Improvement Collaborative, or CHIC, can help build community-based relationships to help reduce emergency department visits and hospital readmissions. You'll identify and engage key partners, and you'll learn how to use data to identify a target population for interventions to address gaps in care. And so why is this important? The care transition team at Superior Health Quality Alliance realizes that it's important, the importance of community partnerships in safe and effective care transitions. That is to impact patient outcomes by reducing avoidable emergency department use and readmissions. The Community Health Collaborative aims to establish local community networks to improve your patients' outcomes by improving safety, equity, and quality of care, and impacting your organizational quality measures. The initial focuses are going to be on care coordination across settings of care, addressing the social-related health needs, social determinants of health, or social drivers of health. Mobilize resources to address community needs, increasing patient satisfaction, improving their quality of life, decreasing healthcare costs for patient and payers. The Care Transition team is available to help your organization establish local community networks to improve your patients' outcomes. So while planning for this collaborative, we sent a poll to potential participants, and we would like you to take a minute to respond to this polling question. Christine, are you ready to launch this poll? It is listed up here with some ideas, but the poll will basically say the same things here. So I'm going to give you a minute here to answer this poll. What challenges do you feel are affecting your patients' avoidable hospital readmissions and ED visits for your organization's quality improvement and care coordination goals?
I think, Barb, you were going to launch that, right? Polling one.
It is launched.
Yeah, I can't see it, sorry.
And if you do, just check all the ones that apply to you. And if you have any other, just put that into chat and we'll talk about those a little bit in the next slide here, but I'm going to give you a minute to finish. Barb, are you able to see if people are responding?
Yes, so it looks like have about 100% answered. And it looks like we're. Oh,
I just put it, I had to answer, I put in other for my response.
So you shifted the statistics a little bit, but just a little. So it does look like care coordination with other organizations during care transitions and patient-related health conditions such as infection prevention and control are the two top ones. And then
Barb, before you go into that, I'm going to go
yeah.
into, so are you able to share that poll result? Or is that not an option?
Yes. Are people seeing the final results there?
I think it's on my screen. Can you see it on my screen?
I can see it.
Yeah, so everybody can see it now. Yeah.
So yes, so right, coordinating with other organizations, patient-related health conditions, patient and family expectations, and then there are some others in there. And that's not surprising. I'll show you now the results of the the poll that we did. Very similarly, we saw that there was a large percentage that patient-related health conditions, again, was our top, one of the top two, as were patient and family expectations of appropriate level of care, current policies and procedures, and coordinating with other organizations. So those were our top four, just as your top three here. And then are there others in chat?
Not seeing any other, that we had any others in particular in chat. No.
Okay. So it just kind of gives us a perspective on what are the challenges in, you know, in patient care coordination. No, I'm not getting to the next screen. Here we go. All right. So this slide gives a little overview of the benefits of participating in the Community Health Improvement Collaborative. You can use this platform to improve your organization's internal quality measures, number one. And it'll help you meet external reporting requirements for reimbursement and quality reporting measures, or clinical improvement activity and social equity initiatives. Secondly, the 6 steps of CHIC. Am I on the right slide? Yeah, I am. Yep, the 6 steps of the CHIC lay out how to establish local community networks to improve your patients' outcomes, safety, and quality of care. It will pave the way for your organization to become part of a shared learning collaborative by providing opportunities to share with others how you've addressed challenges, how to develop sustainable collaborative solutions. And throughout the steps of this collaborative, you will have the opportunity to receive technical assistance from Superior Health Quality Alliance, QIAs, or quality improvement advisors. This will be available whether you participate in person or remotely. Oh, I was on the wrong slide. Sorry about that. So yeah, impacting your quality measures, local community networks, become part of a shared collaborative, and receiving a technical assistance. So the mission of our collaborative is to create an environment and resources for all care settings to use to reduce emergency department use and 30-day hospital readmissions by leveraging collaboration between healthcare providers, community-based organizations, and local resources and supports. The specific aims of the collaborative are threefold: decreasing ED visits for long-term care residents, decreasing 30-day hospital readmissions for long-term care residents, and decreasing 30-day hospital readmissions for all Medicare beneficiaries. So this slide lays out the timeline for the Community Health Improvement Collaborative, which provides a framework and tools for a community-based collaborative. The 6 steps laid out in this collaborative are a compilation of 2 very well-known and well-vetted national tools from AHRQ, Association of Health Research and Quality, and the Hospital Society of Medicine, Hospital Society of Medicine, yes, along with tools from both Superior Health Quality Alliance and other tools that we found along the way. These sessions will be recorded and available for you to review later if you're unable to attend this specific session. However, we do encourage you to attend in person to foster a better learning experience for all of you. You may participate remotely or in person. Each session will have a session guide with links to tools and resources. And here's a kind of an overview of the sessions. The first session today, learning how the program can help your community and organization, and learning how to use data to identify a target population. The next session will, establish community health teams, mobilize community resources. The third session will go over creating action plans and toolkits for each organization. The objectives are listed below. The fourth session, applying setting-specific tools. And the sixth session is creating a shared learning collaborative program evaluation. So if you're unable, I said that. With these sessions, you'll get the links and tools in the toolkit over nearly 4 months. However, the timeline for implementing may take you much longer than that. It depends on where you are in the process of community-based collaboration. So as with any good project, data collection and analysis measures the impact on the identified measures. So we really want to be able to collect data to see how we've done. Yeah, that's better.
So yeah,
we'll
can I just jump? Sorry, can I just jump in quick, Lisa?
Sure.
Yeah,
yes.
So it's really, we're looking to measure the impact on the kind of those identified aims that Lisa was talking about, where we're hoping to reduce ED visits and 30-day readmissions. So here at Superior Health, we're going to look, we're going to try and look at some baseline data, which would really be like the launch of this collaborative starting this month. We'll be kind of taking a look at those performances based on the data that we receive. Now, we do have like a 3-month data lag due to some claims processing. So the data we would get would not be as quick as data that you folks would get in-house, if you will. So if you want to take a look at ED visits and hospital readmits throughout this collaborative on your own, you're welcome to do that. Otherwise, we'll have some data to share probably about 3 to 6 months after this collaborative ends, where we can kind of take a look at performances and do that evaluation. We'll watch monthly rolling 12 rates or performances, which means that, for example, we'll look at April 1st, 2023 through March 31st, 2024 to kind of have that baseline data, and then look at a rolling 12 thereafter. And really for that evaluation, we're looking at kind of some quantitative and qualitative data, the attendance rate at these collaborative sessions, and maybe how, what effects attendance might have on providing you some good tools to help improve on those performances, and take a look at some lessons learned and some barriers at the end of the collaborative. So hopefully I've covered that well enough.
You did. Thank you so much, Christine, for explaining that. And then we're going to be providing some tools in this session for you on how to track some of that data in the session 1 guide. And we do encourage you to, as Christine said, to, we think it's going to be most beneficial for you for organizations to track the data independently. And it's going to be faster and more realistic for you, but also we can later provide that data to you for being participants, but it'll come much later, as she said. Oops, I got to go back to this. So this is kind of the meat of today's slide. On this slide, it really is, step 1 is analyzing data and identifying target populations. I'm just looking at the clock. We have a fair amount of time to go over this. So I'm going to kind of just dive into some of this a little more in detail. So the step 1 has 1, 2, 3, 4 kind of sub-steps, if you will. So analyzing your data sources and identifying common issues and targets. For this sub-step, we have several tools that we're going to be using, and I'm going to share my screen as I have them all pulled up already. So if you link on that session 1 tool on the bottom of that last slide, it said see session tools. This is what you will come to see. Let's see, how can we do this? Enter PDF full screen. Here we go. So this is the session 1 tool. The designing and delivering whole person transitional care from ARC is what we're using for some of these tools. There's a data analysis Excel tool that will help you track readmission rates by the top 10 reasons and payer. It has a dashboard that you can fill in. The second tool is a readmission review Word file. It helps you learn how to elicit patient and caregivers' perspectives about readmission. And then a hospital inventory for those of you who are hospitals to take an inventory of your readmission and reduction activity and the related assets. I think what I'm going to do is stay on this and go through all the tools, and then I'll just briefly show you each of those 3 tools at the end of this slide. So I'm not going back and forth between the screens. The second tool that we've used pretty significantly, and you probably have heard of it, it's the Boost tool. It's a Society of Hospital Medicine. We give you pages. Here's the talking points to garner institutional support. It's really important to get your institution to support your project ideas. And so it tells you how to, get their attention. A sample letter to the administration. A return on investment, how to, give them, what is this going to do for us? What's in it for us? Everybody wants to know that. And then the Boost implementation guide to perform your organizational assessment. The Boost guide actually lays the foundation for improvement that has 7 steps. Ensuring support from the institution, assembling an effective team, clarifying key stakeholders, and assessing previous or ongoing efforts and resources, setting your SMART goals and a timeline, deciding on your key metrics and a measurement plan. Oops. And then on step 7 is choosing a hospital. It says hospital care unit. It doesn't have to be a hospital care unit. Choosing a care unit on which to implement. So those are the 7 steps in the Boost implementation guide. There are also additional resources that I'll cover later down here. But the next step is to perform a root cause analysis. Again, the Boost implementation guide section 3, getting to work on improving transitions. There's 5 steps to that. Understanding the background of your institution, understanding how your current care transition process functions and where it falls, establishing a quantitative data collection plan, understanding why there are deficiencies in your current process, that root cause analysis, and then selecting and tailoring the interventions to fix the root cause of any of those deficiencies. So those are the steps in performing that root cause analysis. And then finally, identifying, once you've done all of those things, identifying your community needs, gaps, and resources, and then identifying and engaging key partners. You do this through a community needs assessment. Superior Health Quality Alliance has developed a community needs assessment that is a pretty step-by-step on how to do that community needs assessment. There are other community needs assessments within the Boost tool, but you might find that this tool is a little more, up to date, if you will. The Boost tool was developed probably 2 or 3 years ago. And so, Christine, I think you were part of this community needs assessment. If you have anything to say about that at this time?
Really, I think you covered it really well, Lisa. It does have, it kind of walked you through a step-by-step. It has some forms at the end of it where, you can send questionnaires out to community or ask community leaders. It helps in identifying key stakeholders, so you can just get a good feel and good grasp on what resources might be available within your community.
Thank you. And then finally, there is another toolkit that was put out by Superior Health, Building a Successful Coalition toolkit. This is an additional tool. It's not following exactly these steps. They're very similar to these steps, but it's a different toolkit, basically. But you can compare and see if you have tools that are in that toolkit that you like better than this one. But we're providing the tools in this toolkit throughout the 6 steps of this process. I want to let you know that this tool for session 1, each of these links are, you can click on it, it'll take you right to the tool. Even though they're not underlined, all of these are hyperlinked, and we will provide, who's providing the links, a link to the PDF for this session 1 tool. So you can certainly link directly from the PDF tool to get to them. And then it has our contact information if you have any questions, and then some of the references. I'm just going to show you this is the AHRQ website, Designing and Delivering Whole Person Transitional Care. So they're, basically this is the website itself that goes through the tools that we're using and what we're referring. It also has the links in there. But I can tell you that their process was a little more extended and expanded than what we're doing. We skinnied it down, if you will, a little bit for this project. This is one of the tools. This is hospital-wide, all-condition, all-payer, payer-specific readmission analysis. This is an example of the tool. How can I get this to... there's some links on that. So here's some data. This is a blank tool. And then there's some links on here that I can't quite get to. I don't know. Maybe if I go like this. So there's a data dashboard, data entry. So each one of these links on the bottom, when you click on that tool, you can go to, and it has instructions on how to use it, etc. So I would encourage you to go in and look at that tool if you want to collect data within your organization, because basically you're putting in the data and then it spits out the percentages. It's a very nice tool. The other tool is a readmission review tool. And this one is, it's over here again. Here we go. Gives you a description, the time required. A lot of these tools will give you, the time required to fill them out. At least so a readmission interview, a root cause analysis and lessons learned. So these are the tools that are in that readmission review tool. Another tool is the hospital inventory tool. You know, it says that it takes up to 4 hours, no more than 2 weeks to complete. And this is the hospital inventory. So administrative tasks, health IT tasks, transitional care tasks, care management, cross-continuum, process improvement, collaborations. The other example is Appendix B of the Project Boost implementation guide. So we're going to be using some tools in here, and as I mentioned, the talking points to garner support from your institution, a sample letter, the return on investment, and I think there's one more. It just have a few pages. Oh, if recording your work. So we're just going through which pages in here you might need to use in the session 1 tool. And this is the community needs assessment that was developed by Superior Health Quality Alliance. And it's, it gives you steps on how to do a community needs assessment. And very involved and detailed. And it has fillable forms within the questionnaire itself. I think the fillable form is down here. Yes, I wanted to get down to. So here's the community needs assessment checklist, and you can actually, click right on it. And these are fillable forms that your organization can use. And then this is the Superior Health Building a Successful Coalition Toolkit. Another bunch of tools that you can use, steps, basically pretty similar to what we're using in this project.
And the only thing I would say about that one that I really like too is it gives you concrete examples at the end of how people did outreach or how they in their community started to build a coalition. So it kind of gives you a sense of what others have done as well in this area. It's kind of nice to have those case studies in there as well.
That's good to know, Barb. I think right at the end of this one, some of these, because it's a pretty long, extensive toolkit. Progress monitoring, resources, action steps. Let's see. I don't know where those were. Resources, action steps. So it must be hidden in there somewhere, but this is 74 pages long. So I won't go through all 74 pages. But really good tools for you to utilize. All right, I'm going to get back to my PowerPoint. Let's see if it allows me to do this. Oh no, now it's showing me this one again. Guys, I'm getting there. No, I think what I'm going to do is I am going to, here we go.
What if you click slideshow right there, like in the middle of the screen?
Oh, there it is.
There
Okay.
you go. And then from current slide. Will that
current
work?
slide.
Yay, we did it.
Now I just got to get to my current slide. Okay, so that was the session tools. This is an overview of those tools. And so now we have an opportunity for some questions. There was something in chat. So the chat has the session 1 tools. Thank you, Christine, for posting that. And I'm just going to go over who was in. Jenny, Sheila,
Thanks, Katie. So
Mary
I
Ann.
have a quick question maybe for those who are connected here. I'm just curious, like, what organizations are folks working with in their community on ED visits or hospital readmissions? Like, I don't know if we have hospitals and SNFs in the room, but do you work with like home healthcare agencies or things like that? You can either unmute or post it in chat. I'm just curious at how people are making those connections in the community to help with efforts. Anyone?
I know what we'd like to know if you're working with other organizations in your community to improve care transitions, and if so, what types of organizations are you collaborating with?
Sky group today.
Oops. I
All right,
must
well,
have hit some buttons here. Sorry about that.
no,
Was
I'm
there any
putting
questions in chat?
none. I'm putting the PowerPoint presentation in the chat though for everybody, Lisa. I did put the session tools link, but there's the
Okay.
PowerPoint presentation link for folks as well.
We do have a very nice comment saying, thank you for sharing. This is incredible work. That's very nice. Thank you, Katie.
Thank you.
But and in our next session, we'll be starting to make some suggestions of organizations that you can reach out to that can help with some of these issues that you might be dealing with. But just wondering if anybody has any particular issues, from the poll, it looked like there were some areas of concern that you were having issues with. But sometimes if you find a lot of people coming into your ED with mental health issues, or they're having food insecurity issues, things like that, that if you could resolve those issues before they get to the ED, or when they get to the ED, any creative care management programs that people might have to help address some of those social drivers that might be coming in. We've certainly heard some innovative programs around that, but just wondering if anybody is seeing like an uptick in that in their emergency department, or somebody might be coming in not so much with a physical health issue, but something else going on in their life that if it was addressed could have helped preventing them from coming back, social support, those sort of things.
Yeah, what's helping, and and have you heard good ideas? As we have these additional sessions, we have the dates up here, the community health teams and resources in April, and we'll have May 1st, and then we'll have 2 in June. Each one of us in this team will be presenting on each of them, but we're working as a team. I also have on this slide your session 1 tools. Again, these are hyperlinked in a PDF to the PowerPoint, and Christine, you shared that PDF for the PowerPoint in here. Thank you so much. And there are links to each of those tools right in the PDFs, the session 1 tools, and this PowerPoint. And we also have a Connect to continue the conversation in Superior Health Connect. That's a shared learning environment for participants to come together. We will post the links to these tools in Connect, so you don't need to worry about, we'd like you to save them, of course, to your favorite folders and be able to access them. But Connect is the place that you can go to easily. You can ask questions, interact as much or as little as you'd like to kind of share, common things and issues within your organization. And then, of course, if you have questions, this is with the free technical assistance that we talked about. Contact Barb, Janelle, myself, or Christine our emails are in here, and then the references are here, but I want to go back up to the polling question. How useful was this session? Is this a specific polling question, Barb, that
I
you'll be
do
launching?
have that ready, but I just wanted to do one more plug for Connect. Christine, do you have the link directly to the group? Yep, there it is.
You
Thank
read
you.
my mind.
That's how we work here. So yes, as Lisa so eloquently outlined what Connect is, but we've developed, so you can go into Connect and get all sorts of resources and information on any health related issue that you may have. We have care transitions, we have infection prevention and control, we have med safety group, we have all kinds of things that are in there. But we formed a private group just for this collaborative, and that link is posted in chat. So if you click on that, you'll just have to do a quick registration with your name and maybe your organization and email. And then that'll get you right into our private group where, as Lisa said, all of this information will get posted. So then if you also register, once we start posting things or somebody asks a question, you'll get an email saying, oh, the video for session 1 is available now for your viewing. And so it's a very nice way to stay connected and get all the information right away once we get it in there. So just wanted to say, please go to chat and click on the Connect link, and that'll get you into our private group and Connect as well. So thank you. And now I will
Yes.
launch the poll.
Yes, and while we're launching that poll, just, additional, just clarification about what this project is all about is, you connecting with another organization or 2 or 3. And, whether that's a food shelf, whether it's a nursing home and hospital collaborative, whatever it is that you find in your community needs assessment is how you determine who you should collaborate with. And we're here to help you form those coalitions. So you should be getting this polling question. How useful was it? Hopefully you'll find these resources helpful and start your journey as soon as possible. And like I said, we'll be having these sessions every month or so, and providing more details as we go along.
And this polling question is anonymous and just helpful for us to sort of adjust and improve on what we're doing. So looks like we have just 2 of the 7 people who've taken the poll so far. So if anyone else is willing to take the poll, it's very helpful for us too.
So we just want to thank you so much for joining us today. We hope that you can, view these sessions either in person if possible, share your experiences with the tools, good or bad. What challenges did you have if you did use some of the tools? What do you offer? Any suggestions? We're very happy to hear, how we can improve for your benefit and your patients' benefits. And again, we'd like to thank you so much for joining us today. Anybody else, Barb, Christine, or Janelle, that have any other feedback that you'd like to share with the group that we haven't covered?
Yeah, I'd just like to say, as people are going through the tools, feel free. Our contact information is in there. You can see Janelle, Lisa, myself, and Barb. All of our contact information is there. So yeah, just feel free to reach out.
It's not too often you get a free support, and this is covered by CMS as part of the CMS projects that we're working towards in helping to get to some of those aims. And yeah, we're here to help. If you need another tool that we're not providing to you, just let us know. It may be addressed later down the line here, but as we get deeper into the weeds, we'll provide additional tools.
Then just really strongly encourage you to register with Connect. It just gets you all those resources and everything 101 one-stop shop situation. So it's very helpful. And it is a nice way to connect with other people in between our sessions as well.
Okay. Well, I guess we give you the gift of about 15 minutes if we're ending early today. So hope to see you at our next session on April 3rd. Have a great day, everyone.